Restricted range of motion in the right hip can be caused by various factors such as muscle tightness, joint stiffness, injury, or underlying conditions like arthritis. Addressing this issue often involves a combination of manual hip mobilization, stretching, strengthening exercises, and possibly other treatments to improve flexibility, reduce pain, and restore normal movement. Manual hip mobilization is a technique used by physical therapists to improve joint mobility, reduce pain, and restore normal movement patterns in the hip. This hands-on approach involves the therapist applying controlled movements to the hip joint to address stiffness, restrictions, or alignment issues. Purpose of hip mobilization: increase range of motion, helps to improve flexibility and range of motion in the hip joint, reduce pain, alleviates pain associated with joint stiffness, muscle tension, or inflammation, improve joint function, restores proper movement mechanics and joint alignment, enhance circulation, promotes blood flow to the hip region, aiding in healing and reducing muscle tightness. When to consider hip mobilization: chronic hip pain, persistent pain that doesn't improve with stretching or strengthening alone, post-surgery rehabilitation. Mobilization can be part of rehab after hip surgery to restore joint movement. Athletic injuries, to address injuries or overuse issues that limit hip mobility. Arthritis, for managing symptoms of hip osteoarthritis and improving joint function. Manual hip mobilization is a highly effective technique for addressing hip joint restrictions and improving mobility. It is typically performed by a trained physical therapist who will tailor the treatment to your specific needs. Combining mobilization with appropriate exercises and aftercare can lead to significant improvements in hip function and pain reduction. Combining hip mobilization techniques with targeted exercises and stretches can significantly enhance and maintain your hip range of motion. By staying consistent and mindful of your body's responses, you can achieve optimal hip function and mobility.